Hello YouTube, I'm Dr. Fox. Today, let me talk about caffeine and pregnancy. Doctors advise mothers to limit caffeine to around 200 milligrams a day. Roughly, this is about 2 cups of coffee, though coffee can differ in strength, so do look to make sure. High levels of caffeine in pregnancy can result in babies having a low birth weight, which can increase the risk of health problems in later life. Too much caffeine can also cause a miscarriage. Tea and caffeine are known by most to contain caffeine, though so does chocolate and also cola and many energy drinks. As caffeine stimulates the brain, it keeps you alert and awake. Okay, what effects does caffeine have on you and your baby? By digesting caffeine, your heart rate and blood pressure increase by a small amount and your body produces more urine. Too much can make you feel jittery, have indigestion, or have trouble sleeping. When pregnant, it may take longer for the effects to wear off, which means caffeine's effect increases. During pregnancy, there is no way to stop caffeine through the placenta to your baby. The placenta grows in your uterus or womb and supplies the baby with food and oxygen through the umbilical cord. Research differs on whether too much caffeine can increase the likelihood of miscarriage, but your medical professional will likely advise caution and restrict you to 200 milligrams a day. Okay, what caffeine levels do foods contain? Caffeine can be found as follows. Instant coffee, 100 milligrams in 1 cup. Filter coffee, 140 milligrams in 1 cup. Tea, 75 milligrams in 1 cup. Cola can, 40 milligrams in 1 cup. 1 cup of energy drinks with 250 milliliter up to 80 milligrams, with some larger cans at 160 milligrams. 1 plain chocolate bar with 50 grams, usually no more than 25 milligrams. Okay, in a day, you will almost reach your 200 milligrams caffeine limit if you have 2 mugs of tea and 1 can of cola, or 1 mug of instant coffee and 1 can of energy drink. Okay, let's talk about methods of reducing your caffeine intake. Decaf versions of your favorite coffee are probably available, though consider including more water or fruit juice in your diet instead of coffee. There should not be much motivation for an energy drink while pregnant. As ever when pregnant, consult medical professionals if in doubt, including when taking any medications. Some cold remedies and herbal supplements can contain caffeine. Look to cut down on tea, coffee, and sugary drinks. Consider the nutrients that your baby needs, which are found in water and milk. Don't worry too much if you happen to take too much. If you occasionally exceed the recommended limit, the risks are quite small. Okay, next, is caffeine safe during breastfeeding? Having caffeine while breastfeeding is not unsafe, but a small amount will get into breast milk, so do not have excessive consumption. Symptoms may include your baby finding it hard to sleep or becoming fuzzy. Be cautious about some other products too, such as chamomile and other herbal teas. Some herbal teas such as chamomile aren't good to drink when you are pregnant. You'll also want to avoid teas with aloe, senna leaves, lobelia, coltsfoot, juniper berry, comfrey, pennyroyal, buckthorn bark, lobelia tea, darkroot, and sassafras. On the other hand, some teas of a herbal variety can be recommended if in moderate amounts. For example, lemon balm, orange peel, rose hip, as well as citrus peel and linden flower. The latter only providing there are no cardiac issues present. Okay, thank you for watching. See you soon.